Alright, today we'll be performing a trunk MMT on my patient here, and I'm testing the rectus abdominis muscles and the inferior obliques, and those are innervated by the intercostal nerves T7 through T12. And so what I'm going to do is I'm going to start at a grade 5, and I'm going to have my patient here put her hands just behind her neck like so, just to support her neck in this motion. And what I'm looking for is her inferior scapula to clear the table, so that's just right here, Vanessa. So what I want you to try to do is sit up just towards me, just clearing those off the table. Good, and back down. And since she was able to sit up and clear the inferior border of her scapula, I can grade that at a level 5. If she struggled with that, I can change the position. I'm gonna have you cross your arms across your chest. Go ahead and try that again. Clearing that inferior border would be a grade 4. If she struggled with that position, next one would be arms by her side there, and we would perform the same motion. And if she struggled with that position, I would then be down to grade level 2. And for grade 2, I'm looking for her cervical spine to clear the table there. And so I'd have her try, and then the cervical spine cleared, so that's 2. And then our last grade would be a grade 1, and I would just be feeling for trace of the rectus abdominis and the internal obliques. When performing the trunk flexion MMT, if you know your patient has weak hip flexors, one thing you can do as the PT is just stabilize at the hips, but there is no specific position for this MMT for the PT. Today I will be performing a hip flexion active range of motion on my patient here, and the starting position for the patient is going to be lying supine, and as the PT I'm going to just be staying on the same side that I am testing for. And so first I'm going to have my patient just try to bring her knee up towards her chest, bending that leg just to assess for her normal range of motion. And then I'm going to be using a goniometer today to measure her active range of motion for hip flexion. My fulcrum is going to go right here on her greater trochanter, and my stationary arm is going to be midline to the pelvis, and my distal arm is going to be from her lateral femur all the way down to her lateral epicondyle. And so what I'm going to have my patient do is do that motion that we just did earlier, and my hand's going to just be back here on her back, feeling for her PSIS, because I want to feel for when she's going into that posterior tilt. So I'll know that happens when her PSIS kind of drops into my hand. So go ahead and bring your knee towards you like you did earlier, Vanessa. Perfect. And go ahead and hold that motion for me if you can. And again, I'm going to put my fulcrum here on the greater trochanter. And my stationary arm is with her midline pelvis, lining that up with the condyle. And she's at 118. Normal is